Here we go. All right, so our injury that we are tackling today is shoulder impingement, aka subacromial pain syndrome. Our case study was this client named John. He's a 52-year-old male who works as a cabinet installer. His current activity level is very high. He's an avid rock climber and skier, which he's been actively doing for over 30 years. He was training for the upcoming climbing season, and his program included weighted pull-ups that he was doing 3 times per week for the last 4 weeks. And he was progressively increasing the weight every 2 to 3 sessions. But by the 4th week, he was complaining of achiness in the right shoulder, particularly with overhead motion, so pain with shoulder overhead. So achiness when he's lifting his shoulder overhead. He said he could still do pull-ups, but notices pain in the initial pull up to about 120 degrees elbow flexion. And he also has trouble sleeping due to pain when sleeping on his right side arm or with his arm above his head. Oh, here we go. So the shoulder impingement, the area where it happens in the shoulder includes the acromion rotator cuff tendons, subacromial bursa, and long head of the bicep tendon. The movement that these structures allow for the shoulder are flexion, extension, abduction, adduction, internal rotation, and external rotation. Shoulder impingement basically dysregulates that movement and impairs that movement. So possible risks with shoulder impingement are overuse, repetitive overhead activities, poor posture, muscle imbalances, inadequate stretching routines, and non-modifiable risk factors, including anatomical variations of the shoulder structure, occupations, and repetitive shoulder use in certain sports.
Okay, and then some risk factors and signs and symptoms. So possible risks are overuse and repetitive overhead activities, poor posture, muscle imbalance, and inadequate stretching routines. And some non-modifiable risk factors include anatomical variations of the shoulder structure, occupation, and repetitive shoulder use in certain spots. And then common signs of shoulder impingement are pain and achiness in the shoulder area, especially during overhead activities. This would include such as lifting, reaching, and throwing. Pain can radiate down the arm, and individuals will have weakness and loss of range of motion. And then some just diagnostics and treatment. So diagnosis would be an exam by a medical professional. This assessment would include the range of motion, strength, and assessing symptoms. An X-ray, MRI, or ultrasound may be ordered to confirm diagnosis or check severity. Treatments for this type of injury would include rest, activity modifications, physical therapy to improve strength and flexibility, or like medication to help with pain and inflammation, corticosteroid injections, and lastly, surgery, just to make more room in the subacromial area, so, which will elevate the impingement.
All right. And then some physical therapy exercises are isometric shoulder internal and external rotation, line external rotation, internal rotation with resistance band, shoulder scaption, back shoulder stretch, banded external rotation to press. And then the recommended sets, reps, and frequency for each of these exercises. According to a meta-analysis, most patients find symptoms relief after 5 weeks of following a shoulder rehab protocol. And the frequency was 4 to 5 times per week with 3 sets of 10 reps per exercise and then 3 sets of 30-second holds for stretching or isometric exercises. So one of these exercises is the isometric shoulder internal and external rotation. And for internal rotation, stand at the base of a door with your arm in front of you with the elbow bent at a 90-degree angle. And then with the flat hand, you push into the door base with 25 to 50% pressure and hold it for 10 seconds. And then for external rotation, it consists of pressing the outside of your hand against the door base, and then you'll use 25 to 50% pressure and also hold it for 10 seconds.
So for the lying external rotation, that would be lying on your side with the injured shoulder on top and having the arm bent, the top arm bent at the 90-degree angle. And you keep the shoulder at your side, lifting a light weight and slowly increase if needed, just depending on how that feels on your shoulder. And then slowly rotate your shoulder, moving your hand up towards the ceiling, just sort of like the pictures demonstrate. And then with internal rotation with resistance band, you would attach one end of the resistance band to a door handle and the other to the end of the hand with the arm that has the shoulder injury. And then bend the elbow and keep it at your side and rotate the shoulder to move it across your body while keeping your elbow at your side. And you would do this very steadily and obviously at your own pace to make sure you don't injure your shoulder even further. For shoulder scaption, this would be standing with a light weight in your hand, and you lift your injured side slowly until it's extended to about a 45-degree angle away from your body. And then you would slowly bring it back down to the side of your body, back into that normal position. And then for external rotation to press, this one, you're going to want to use a band and have that attached to a door or a rack at about shoulder height. And then start with the shoulder abducted to about 90 degrees and the elbow flexed at 90 degrees. And then externally rotate the shoulder and then extend the elbow directly overhead. And then return to the starting position. And then you just repeat this for that number of assigned sets and reps that you pre-decided that works with your shoulder, not to overdo it.
All right, that's the end of our presentation. Okay, cool. Let me just make sure that